Hello and welcome to the Melbourne Clinic, Australia's largest and longest operating private mental health hospital. The hospital is located centrally in Richmond, Melbourne. It has 175 inpatient beds, a very large day program and outreach service.
And we provide inpatient and outpatient care to patients suffering an array of psychiatric disorders.
Healthscope purchased the Melbourne Clinic in 1985 as its first hospital. Healthscope now has 44 hospitals in its group. We currently have over 300 accredited doctors. We have very good ongoing education at CPD, as well as peer review and support.
The Melbourne Clinic is unique, firstly in its size, being 175 beds, and also the breadth of the programs that it offers. The day programs are probably the most extensive within Melbourne and provide care and support to patients with a wide range of disabilities and psychiatric diagnoses.
Sometimes we've got up to 33 groups running in a week, and they focus on a number of different therapies, but the main aim is for people to be able to come along somewhere and access some skills and support and structure.
But the really great thing about the groups is that it gets people out of their isolation and back in connection with other people. And obviously when people have been unwell, the unwellness that they're experiencing often isolates them and stops them from relating to people. So it's a really important thing for people to get back into relating to others and socialising in a way that's really safe, so that, you know, once they sort of get on their feet with relating in this safe way, they can then move out into their lives and bring that into their relationships.
Melbourne Clinic Outreach Program is a community-based program where we go as clinicians and see people in the community suffering from a mental illness that have been referred to us by their psychiatrist. We're currently seeing 450 people across the greater metropolitan area of Melbourne. We also have the facilities to see people in Bendigo and also in Ballarat.
The clinic has a long association with the University of Melbourne, which involves both research around medication usage and also around teaching medical students and assisting with the training of psychiatrists.
The professorial unit is a 25-bed unit. We adopt a multidisciplinary approach, looking at both the biological, psychosocial, as well as cognitive approach for treatment. Our goal has been always to try to translate evidence-based into clinical best practice in the real world.
Amongst the clinic specialist services, we provide an extensive treatment for people suffering drug and alcohol problems, and my own special interest is in old age psychiatry. We provide an extensive array of services for older patients.
We also offer the anxiety, depression and obsessive compulsive disorder program, which is the only type of its service offered in the country.
The TMS machine, which is there in the background, is like a giant magnet that sits on the front part of the brain here. And it delivers magnetic impulses, which then generates electrical activity in the part of the brain, which is underactive in depression.
People come to the Melbourne Clinic from all over. It's fairly easy to make a referral to the Melbourne Clinic. A family can refer, a patient can refer themselves, or a GP can refer. Most of our referrals come via a GP. We have parking for about 200 cars, so parking is very easy. And there's easy public transport access via a number of tram routes. There's a large number of eateries around, some very good cafes, and hotels too for families that have come to visit somebody that may live in country Victoria or interstate.
I spend a lot of time with patients on encouraging them to really talk things through with their psychiatrists and give them the confidence to feel that they can inquire and stipulate what they want to achieve and where they want to get to and whatever. Because sometimes they don't feel very empowered to do that, just because of the mental status that they have at the time. But the big thing is to see that people begin to get a sense of hope. A lot of them just have felt that they're going nowhere, and gradually they begin to see that there is light at the end of the tunnel.